Hi everybody, today we're going to present you the toxicology of Solanum dulcamara by Pauline Delescluse and jullienne. We're going to start by the description of the plant. So the scientific name is Solanum dulcamara and the common name is bittersweet or climbing nightshade. Solanum dulcamara is part of the family of Solanaceae. It's a native species from Europe, Asia and Africa. Bittersweet nightshade is a vine-like plant that has been introduced in many regions that include North America, Australia, and New Zealand. They can reach the length of 2 to 4 meters and have flexible stems that can climb and twine over different structures and vegetation. Their flowers are star-shaped and are arranged in loose clusters along the stems. They usually grow from late spring to early summer in moist habitats, such as forest and wetland. The fruit of bittersweet nightshade are small red berries that contain many seeds, like other members of Solanaceae family. They contain toxic compounds that are really concentrated in the unripe berries. The toxic and active principles present in the plants. So alkaloids are the active component of the plants. Solanum dulcamara contains solanine that is present in the berries and green part of the plant that act as a natural defense against herbivores. Solanidin present in the green part of the plant and berries contribute to the overall toxicity of the plant. It affects the cell membrane that lead to gastrointestinal disturbance, vomiting, diarrhea, anorexia, and hypersalivation. In severe cases, it causes neurological symptoms like confusion, hallucination, muscle weakness, and respiratory depression. We're now going to talk about the toxikinetics and mechanisms of action. This plant contains steroidal glycoalkaloid solanine that is the primary form acting on the nervous system. After being ingested, absorbed, and distributed through the body via the bloodstream, they penetrate various tissues. Solanum dulcamara primarily disrupts the cell membrane that lead to cell damage and leakage, but also inhibit acetylcholinesterase activity. It induces an accumulation of acetylcholine in nerve synapses that overstimulates cholinergic receptors and results in neurological symptoms. Bittersweet nightshade is eliminated through renal excretion. So now we're going to see the condition in which poisoning takes place. So poisoning affects mainly livestock animals such as cattle, sheep, and goats, but can affect others. It takes place when animals are grazing in fields where nightshade is abundant. The hazard of poisoning depends on the species and maturity. Leaves and fruit are toxic and can be fatal if ingested. The diagnosis of the toxicity. Diagnosis is carried through a physical examination, history, and exposure of the animal to the plant, and then some laboratory tests that includes complete blood tests and urine analysis to see if there is imbalanced organs function, a toxicology screening that is more specific, an X-ray, for example, gastrointestinal obstruction, and a histopathological examination of tissue and lesion. It assessed generally in postmortem animal. We're now going to see an example of a clinical case. We're going to see the intoxication of Solanum dulcamara in a golden retriever. It's a healthy 10-year-old male Labrador retriever puppy weighing 6 kilograms that presents some symptoms after having eaten an unknown plant. The symptoms are some weakness, ataxia, generalized muscle tremors, and vomiting. To continue, we did a physical examination. We saw that the puppy was pyrexic with a temperature of 39 degrees, tachycardic with a heart rate of 160, and tachypneic with a respiratory rate of 50 breaths per minute. The blood tests show a mild hypercapnia at 47.9 with mild hyperglycemia and anemia. The patient was vomiting plant material and food. The plant material was composed of unripe berries and dry stems that had been identified by a botanist. After all clinical examinations done, the diagnosis is confirmed as an intoxication to Solanum dulcamara. We're now going to see the treatment. The treatment included the administration of oxygen, lactated ringer's solution diazepam, propofol, and metocarbamol in IV. He also received an endotracheal tube and a gastric lavage. The dog was in continuous monitoring while processing a free-view thoracic radiograph that showed a diffuse interstitial pulmonary infiltration that indicated aspiration pneumonia. The tracheal wash cytology shows neutrophilic inflammation that confirms the diagnosis. In this slide, we can see free thoracic radiograph that shows interstitial fluid on both lateral projection but not in the ventral dorsal. They are not dependent alveolar to say that we have aspiration pneumonia because it was in a too early stage. To conclude, Solanum dulcamara is a toxic plant due to its composition, which can cause poisoning when ingested by animals. They include many symptoms that can be very severe. Treating infected animals involves supportive care due to important complications such as dehydration, seizures, and respiratory distress. To prevent infection, we need to restrict access to the plant, pastures, and area where it grows. You can see now our bibliography with all the links. Thank you for your attention and hope that you have enjoyed.